Hello, we are Amiga Security Systems and Leeds Beckett University. We are a security company who design, install and maintain CCTV, access control, barriers, gates and intercoms throughout the UK. We employ about 20 people and went limited in 2006.
Hi, I'm Sean Hanlon, I'm the Chief Medical Officer of the EMIS Group. We provide healthcare IT across all healthcare environments in the UK, and our principle is that we're joining up healthcare between all of the disparate parts of the NHS. So EMIS is 30 years old this year. We've grown and we've now got 1,200 employees across the UK. 800 of those are based here in Leeds.
I'm Giles Hodgson, I'm the Orthotics Operations Director for Steeper Group here in Leeds. There are three parts to the Steeper business. The first is assistive technologies. This helps people who are bedbound or wheelchair bound to control their homes, so it gives them more independence and freedom. The second part is prosthetics. So these are artificial limbs for people who have lost limbs. And thirdly, orthotics, which are products to help people who still have limbs but need some sort of support. We've been in Leeds for approximately 30 years on this site in Hundlet. We employ approximately 200 people in the Leeds area. The business as a whole employs over 400 globally.
I'm Graham Hall, I'm the Managing Director of Brandon Medical. We manufacture operating theatre equipment and equipment for intensive care units. It was founded in Hunslet in 1946, and in 2012 when we moved to the current unit in Morley, which is a 50,000 square foot factory which we refurbished as part of the move, with a training centre, design engineering centre and visitor facilities with an operating theatre and an intensive care unit. Brandon Medical currently employs 57 people. For each person that we employ in the business here, we create work for another 2 people locally in the local community around Leeds. Property for industrial use was actually good value around Leeds. Hard to find and not a lot of it. It's a reasonable quality, but the price has been quite good, certainly compared to other parts of the country.
Well, recently the business was flooded last year, and post the flood we had a lot of support from Leeds City Council, which helped us get back on our feet. Subsequent to that flood, moving to a new building also in Leeds, and Leeds City Council has also supported us with that, which has made a significant difference to the costs and the impact of the floods, not just financially but also in support and help around regulation.
We have lots of customers based here, but we also have a lot of national customers that have operations in Leeds. I think one of the main things of late is the collaborative approach to business, i.e. with Leeds Beckett and Innovate UK and things like that, which I think is the way forward in business, is collaborations and partnerships. And in Leeds that's readily available.
The key benefits we get from being in Leeds are the talent pool, the people. They are the proximity to our key customers such as NHS Digital, and a fantastic infrastructure that actually puts us at the centre of the UK. So we have customers in Scotland, we have customers in the West Country, lots of customers in London. It's actually really easy to get to Leeds and it's affordable. And those things together actually make Leeds an ideal hub for a business like ours.
One of the key advantages of being in Leeds is access to people, and therefore the future access to those skills and experience are what help to retain our interest in the city. We have no intention of moving out of the city, but we have a lot of skilled staff who live in this area, work in this area. We have access to apprentices, we have access to people who have been to university in Leeds. So the different requirements for the business are serviced by the makeup of the city and the education system within it.
Throughout the partnership, stronger knowledge coming from the university and expertise in such domains we are not usually accessible for a company working alone.
We export half of what we make, and when visiting companies from overseas come here and our local hospital doesn't use our equipment, that's very detrimental to the growth of our business. It seems very difficult to actually get buy-in at the middle order of the system. You know, people at the top and the bottom say, yeah, it's great, we could buy equipment from a local company, we service locally, employ local people, but they still don't actually manage to get those systems to work to buy the equipment from a local company that's, you know, cheaper than the opposition and in many cases has better equipment.
I think Leeds is a great place to cultivate talent. One of the challenges we have is that lots of other industries have recognised the same advantage of Leeds, and we're now finding that there's more technology-based industries or technology-based services who are setting up in Leeds, who's drawing down on that talent pool. So one of our challenges with Leeds, and something would be great to try and address, would be how we could work to help increase the talent pool who are interested in pursuing a career in healthcare IT with a business like Emis Group.
Being a healthcare business, then we contribute in two key ways. One is the health outcomes of patients, assistive technologies which help people to live in their homes independently, through prosthetics which allow people to regain mobility having lost a limb, and through orthotics which help people retain mobility but also prevent deterioration. On the other side, we employ lots of staff within the region.
It's pretty well known that employed people are healthier than unemployed people. As a business, we employ a full spectrum of people from postgraduates, graduates, professional engineers, accountants, but all the way through to semi-skilled, skilled workers and unskilled people. We need good quality jobs at every level. You know, not every person that comes out of our education system can be a managing director or a chartered accountant. There's lots of people that need work that isn't academic, especially if you're trying to develop jobs for the people in the society who haven't got professional qualifications.
Although Emis Group looks after the healthcare of over 30 million patients, we also take great pride in how we look after the healthcare and the well-being of our staff. So over the last few years, we set up an employee wellness program that focuses on key areas such as smoking, nutrition, healthy mindfulness and exercise. We also contribute actively to the Leeds Health Record, whereby any patient's record can be viewed whichever part of the health sector they're accessing. Lesser known, in fact, we also have patient.info, which is a website that 30 million patients across the UK visit every month. And so people in Leeds will actively use that to help manage their own healthcare. Did an interesting program in Bristol where we use record sharing to support the homeless community, and that type of project could very easily be replicated in Leeds. In summary, Emis Group is delighted to be contributing to a number of the key strategies that Leeds had around health and wellbeing of its population.